Hi, everyone. Let me just share my thoughts about the discussion board, our first discussion board in MHA 621. Thank you so much for your participation, for engaging in the topic on neighborhood nursing. Um, really, this fell within the content area of access, and, I can tell how engaged all of you were in terms of your thoughts. Um, and really, as this application seeks to go, I would say, go back to really sort of the basics of primary care, but also looking at chronic illnesses within communities, within neighborhoods where there are a startling number of disparities. Now, I think all of you, realize as you were going through this that started, in the Baltimore area, sort of taken off. Um, in other communities, still very much urban type communities with a nurse slash community health worker team. What I think is, I'm going to see if I can key, and I appreciate some of your comments about how it had this dual focus in terms of access of providing primary care, but also um, chronic disease management. But the thing that sort of stood out to me, let's see, I'm not even sure what color I have here, is it meets people where they are. So it's not just going to their homes, right? Because for all individuals, most individuals, even if they have serious social determinants of health issues or chronic health issues, um, they tend to follow the patterns of where they go, grocery stores, wherever else. Probably shouldn't do that. That's a little strange. Sorry about that. Um, so, but it meets people where they are, which I think is key. The other thing that I think a number of you highlighted is the idea is listening to what matters most to them. So this is a particular area that I'm very keen on, not just because if you've heard of um, the four M's of healthy aging, or um, the first M is what matters most. What's most important to them at this point in their life, in addition to their health needs. Um, so I think that's an important key that many of you touched on. I asked each of you the question, do you think this would work in your area, your neighborhood? And I know that I appreciate the responses because some of you, as an example, live in very rural communities, where, let's say, the homes or residences are acres apart. But again, think about perhaps not just the homes, but where people end up. I was giving a presentation on to faith community nurses a couple weeks ago. These are nurses with years of experience, but very much tied to a congregation. And the idea is to use it, where people come together for faith services. It doesn't matter what faith is. That's also an area where primary health care, both behavioral and medical health, medical issues can be discussed. But it's other areas as well. So notice what is not in here, and you all know this. It's not a clinic, it's not a dental office, it is not a hospital. Um, so again, essentially going back to where healthcare around the world really started, where clinicians went to, where people were. The last thing I'll say is, and I think many of you, because you put on a very pragmatic hat, is thinking about, well, how is this to be staffed, right? Um, Easily half of you in the opening voice thread presentation, where I asked you to talk about the most pressing issue in healthcare, talked about staffing issues. And I understand that from where you sit, that is it. But it's also where we sit as users as well. How do you staff all these things? Um, that's absolutely correct. And but this is a very direct intervention. So just my overall thoughts. I don't know if this was helpful or not. I think really want to encourage everyone to participate as much as they can. We only have one more discussion board. I think you'll really enjoy that topic. It's very relevant. The more that you can engage and read and learn and connect with each other, the more you're going to learn. And I think it's valuable. Okay, I'll let you go. Please reach out if you have any questions, folks. Bye.